You've announced a review into the use of oximeters, which have led to an underestimate of the treatment needs of people of colour. Is that an admission that our health services have a systemic, undeclared racial bias?
You know what? There may actually be health services across the world a systemic racial bias. I'm sad to say, and this came about because there's lots of health disparities in our country. There are in many countries, but we saw that I think quite acutely during the COVID crisis. If you were from a BME background, you were a third of admissions were from BME background in ICU units at the height of the crisis. And that compares to, that's more than double the representation in the population. And I asked my team to look at this in some detail. I wanted to really understand what was going on. And one of the reasons they came back with was around pulse oximeters, a medical device that tells you about your oxygen level, crucial with COVID and combating COVID. And in many cases, it was giving false readings. And what really got me was that this was already known. There are research papers already on this, and no one did anything about it. Now, I'm not saying this was deliberate by anyone. I think it's a systemic issue potentially with medical devices, and it may go even further than that with medical textbooks, for example. And so that's why I've announced today that this is something I think that we should do something about, not just here in the UK. I want to work with my colleagues across the world. I've already talked to my counterpart in the US, and he is as interested in this as I am, and see what we can do, because clearly something like this can never be acceptable.
As you said, this is not just something we've discovered with COVID. This particular thing was known before. There's been lots of work which shows that medical trials, which I think you've mentioned, are frankly the samples, which contain thousands of people, are often racially biased, not enough people of colour in them. And of course, we've had a report from a group of MPs this week about the treatment of people with sickle cell anemia, who are almost exclusively black, and the deficiencies in that. Bluntly, can, frankly, people like you and me really trust that the NHS is going to treat us fairly?
I think we can trust the NHS, but I think, of course we can, and let's not. The NHS has been there for all of us for decades now, and helped every community in Britain, and that's of course something that is right. But we should always be looking to see what can be done to improve things, and this particular issue about racial bias in medical instruments, it's global. It's nothing to really, I think it's not really about the NHS. It's a global issue. These oxiometers are being used across the world. They all have the same problem. Some of the other issues we've come across, and you've mentioned around sickle cell anemia and things, these are global issues. And I think Britain is in a place to take some leadership on this. And as I say, as I've discussed it with my counterparts, some of them have been surprised about this, about the evidence that I've presented them with, but they are all united in wanting to do something about it. And I hope that I'm in a position over the next few years to do more about this and let Britain take the lead.
All right, this week we've seen the return of lockdown across Europe. Do we need to prepare for more restrictions here before Christmas?
Well, I think as we all look forward to Christmas, it's very sad to see cases rising, surging in certain parts of Europe. Now, we've always known that this virus, it loves the winter, it likes the cold, darker days that winter brings, and we need to make sure we're doing everything we can to protect ourselves against that. What's made a real difference here in the UK is our booster programme, our hugely successful booster programme, almost 15 million booster jabs given already, covering some quarter of the population over the age of 12, almost 400,000 a day across the UK. And that's making the difference. And we know that because just this week there was more data published after more studies that shows that the protection you get from your booster, the change in your protection, it almost doubles from 50% to over 90%. And I'll be extending the booster programme starting tomorrow to 40 to 49-year-olds. But, all of us, we've all got a role to play in this and in our national vaccination programme. And if you're eligible for whether it's your first shot, second shot or your third shot, please come forward and let's look forward to Christmas together.
All the same, as one of my Australian friends said about COVID-19 just before they went back into huge lockdown, this thing is a tricky bugger.
It is.
Shouldn't you be dusting off Plan B, vaccine passport, requirement for masks, just in case?
Well, the first thing I'd say, Trevor, if I may, is that we made a tough decision back in the start of the summer. Other countries didn't follow our course, and we decided that, of course, we want to start opening up. And if you're going to do that, it's best to do it into summer. It's far safer to do it in summer. Sadly, other countries in Europe did not do that. But looking ahead, as we look down towards winter, we need to make sure that we remain cautious. We are not complacent in any way. I've mentioned the importance of the booster program, but in terms of any other potential measures, we've said all along we've got Plan A, and that's where we firmly are at the moment. If we needed to take further measures with Plan B, then we would do so, but we're not at that point.
Yeah, but I suppose you've pinned all your hopes on the vaccine rollout successful, booster program going quite well. But isn't the truth here that this is a disguised form, frankly, of herd immunity, either through vaccines or through natural immunity induced in those who've had COVID? Isn't this really still pretty risky?
I wouldn't accept the way you've put it, really, and if I may, and the reason is because, of course, the vaccines are a hugely important part of our protection against this horrible virus, but beyond that, there's a lot else going on. So
you have basically let it go far in the hope that the vaccine would get ahead of the spread.
No, not at all. If you look at what else that we are doing, look at our testing system. We have a juggernaut of a testing system, more than, I think, any other country in Europe in terms of the availability of tests, the type of tests. We have a surveillance program that is the envy of the world. We have clear guidance out there. We've taken decisions, for example, the one I announced last week around NHS compulsory vaccinations for people working in the NHS, in care staff. So taking together, I think these are, of course, the right measures. But where I think you would be right, of course, we need to remain cautious. This thing can be very unpredictable, and we need to be ready and monitor the data extremely carefully, and that's exactly what we do.
But cautious relative to, I mean, even in the UK, England is an outlier. Yesterday at Hampden Park, fans were required to show that they had been double jabbed before they could get into the stadium. Today, Man City are going to play Everton, 52,000 people, no requirement to show you a double jab. I mean, we are taking the risky path.
But we've made a decision in this country to take a different path in some ways. We don't have the so-called sort of vaccine passport. If an operator, a venue operator wants to take additional measures, that's up to them. But I think the package, the balance that we set out in Plan A, and then making sure that we've got contingency measures in place, the so-called Plan B, I think has been the right path, has been proven to be the right path. I think we can safely say that so far. But as I say, we can't be complacent. And can I also mention the flu jabs? Yep. The flu jabs are a hugely important part of our winter plan, and we're seeing record numbers of people come forward for those as well. It's the biggest flu vaccination programme this country has seen, and that's just as important this winter as COVID booster shots.
Well, look, forgive me for banging on about the risk here, but we know what the real issue here is, that the NHS will be overwhelmed. I'm going to talk to Chris Hopson, the boss of NHS providers, later, and he's going to tell me that it's dire. You yourself have said that waiting lists could climb as high as 13 million. Do you happen to know, by the way, where we are on waiting lists this weekend? What's the number?
It's 5.9 million, roughly, and waiting for people waiting for elective procedures is around 5.9 million. And as I've said, I've been really clear, this number is going to go up before it comes down. Why? Because some 7 to 8 million people stayed away during the height of the COVID crisis because they were asked to. They did what was asked of them. But I want them to come forward. I want them to come back to the NHS. I want them to know that it is open to them. And if you take that along with normal demand, of course, that's huge pressure. And can I say, you're right to talk about the pressure on the NHS. It is significant. And I think everyone working in the NHS, and certainly from everything I hear, everything I've seen, they are doing an absolutely amazing job, and they will get all the support that we can possibly provide. 5.9
million. Are you actually going to wait till we hit 13 million before you do something like, for example, bring the Nightingale hospitals back into operation?
Well, the 13 million number was if we'd carried on with business as usual. Of course, what we've done in the last couple of months is set out our plans for the longer term, not just this winter, but over the longer term with the new new funding settlement for the NHS, which will allow us to invest more, whether it's in the workforce.
But at what number will you decide to do something like what they're doing in Scotland, what they're doing in Wales, what they're doing across the continent to arrest the spread of transmission? Are you just going to wait?
No, that, Trevor, if I may say, that's more around winter pressures. The elective procedures back, that will take time. It's not just a question over the winter. It's going to take the time after the winter, of course, to continue to work through those people that are waiting for procedures. Over the winter in particular, as we know, COVID particularly likes the winter, we set out our plan A, but when it comes to winter pressures for the NHS and where they are significant, I readily accept that's where we've provided more support, an extra £5.4 billion of funding over this winter for the NHS and for the care system, because they're very linked in helping to deal with winter pressures. And that has provided support, for example, for more 999 callers, 111, ambulance services, a discharge fund for people that are ready to be clinically discharged from hospital but a care place that can't easily be found, so more funding for that. So all of this is helping. And let me be clear, I'm not pretending for a second that this is going to take away all the pressures of the winter. Of course not. We normally have tough winters, and with COVID, it's going to be even harder. But I think the NHS is doing a fantastic job, and we will support them in every way we possibly can.
All right, let's talk about another source of pressure on the government. I mean, not that you haven't got enough already, but we know that there have been record numbers of people landing on the beaches from the continent this weekend. In 15 months you were Home Secretary, we saw fewer than 2,000 a year landing. In 2020, that number quadrupled to 8,400, and we know this year it's increased to 24,000. That's 10 times the number when you were in office. Would you have tolerated this kind of breach of our borders?
Well, the first thing is that we are seeing a huge rise in irregular migration across the world, including, of course, Europe. And sadly, we're seeing many of these people smugglers, these criminals, these vile criminals that are exploiting people. And what we're seeing in the Channel is that sort of so-called business model of these smugglers. I mean, this route, this 21-mile route across the Channel, this is some of the most dangerous waters in the world. It's one of the busiest shipping lanes in the world, and no one should be risking their life across this. And it's the people smugglers that are to blame for this. And it's right that the Home Secretary is looking at every option that there is to try and break this business model.
That's all true, but the words "take back control" echo in my head. And it seems to me that the last thing that's happened is that we've taken back any control. In fact, we've handed it over to the people smugglers. Would you have tolerated this number crossing the Channel were you Home Secretary?
Well, no one will tolerate this number. The Home Secretary has set out how this is...
Does,
no, of course not. She's doing a huge amount of work in trying to break this business model. So the Nationality and Borders Bill that she's brought in front of Parliament now, coming back to the House of Commons soon, that is setting out a whole bunch of new measures and actions we can take. And let's be clear on this, Trevor, that people that are... This country has a great track record, rightly so, of providing security and protection to those people who are genuinely fleeing persecution. And we've done that recently just with Afghanistan, and it's been right to do that. But we do have to ask ourselves is that if people are trying to get to the UK from safe countries like France, are they genuine asylum seekers or not? And it is right to ask that, and it is right to change the rules to take that into account, and that's what the Home Secretary is doing.
All right, one quick last point on this. How are the talks with removing them to Albania or Rwanda going?
I'm not going to comment on any speculation. Nice try. I don't think you expected me to say anything else.
All right, let's talk about cricket and race. Now, I assume you'll have followed, like everybody else, the dramatic revelations from Yorkshire. Can you empathise with the Azim Rafiq story? Are there things in your own experience with which this resonates?
Yes, of course. And when I first heard about this, and that was when I really looked at it, was when I think it was a leak of the report that the club had done on this issue, and it really just shocked me in this day and age that the people doing this report would have these views that somehow being called is banter. It's not. It never has been. And yeah, you asked me about personal experience. Yeah, when I was growing up as a kid, I was called almost every day at school. I didn't like it then. I don't like it now. I think the good news is our country has come a long, long way since then. But clearly not every institution in the country has taken that journey. And it's clear to everyone now that Yorkshire County Cricket Club is one of those institutions that has been stuck in the dark ages and needs to change. That process of change, I think, with Lord Patel there has begun, but there's going to be a long way to go. And the ECB should be doing its job to make sure that this is taken seriously throughout cricketing in the UK.
Just in passing, I noticed that, and it's interesting, you can use the P word, I obviously cannot. But it's an interesting question about how we deal and talk about these things. But a specific question, really. We've been talking about all of these things, and you and I have talked about it before, cricket, football, in politics. When the government thought that the incursions on freedom of speech in universities were getting out of hand, it has intervened. There's a new piece of legislation. Don't you think it's time, seeing what we're seeing on football, more complaints from football referees this morning, daily revelations about cricket, isn't it time for the government essentially to stop trusting the sporting authorities, the ECB, the FA and all of that, who clearly, from what we've seen, failed, and for the government to step in the way it has done in universities on freedom of speech?
Well, I think it's a very good question, because I think the sporting authorities, whether it's football, cricket, they talk the talk, but what have they actually done that's really helping? And I remember when I was the culture secretary and overseeing sport in this country, I remember meeting the ECB then about issues of racial discrimination in cricket, and they were telling me what they're going to do. And look where we are now. Many years later, look at what's happening, look at what's being uncovered. I don't think the ECB has taken this issue very seriously. I think they need to take a long, hard look at themselves. And now this is a real test for them. And let's see if they can pass it.
And if they fail that test?
Then let's wait and see. That's going to be a decision for the Culture Secretary. But I will say this, that the Culture Secretary, the current Culture Secretary, takes this issue just as seriously as I do.